Welcome to Medicuisine. Today we are going to discuss about Huntington disease. This is our second video from the neurology section, and the outlines of today's topic include understanding Huntington disease, mode of inheritance of the Huntington disease. As you know, it is a genetic disorder. It is inherited. So it is a mode of inheritance, a specific mode of inheritance, which we will discuss in details in this video. The clinical presentation and diagnosis of Huntington disease, and in the last we will talk about how we actually manage this disease. What are the treatment options that we have for this disease? So as long as Huntington disease is concerned, it is a genetic degenerative disorder where there is degeneration of the GABAergic neurons. GABAergic neurons actually in the caudate nucleus. As you know, GABAergic neurons are inhibitory neurons. GABAergic neurons are inhibitory neurons. So due to degeneration of these inhibitory neurons, the excitatory signals in the brain overweights the inhibitory signals. This imbalance between the excitatory and inhibitory signals in the brain is manifested as purposeless movements of the different parts of the body known as chorea. So Huntington disease is primarily a movement disorder. Although dementia occurs, the memory problems occur late in the course of the disease, but this is primarily a movement disorder. Primarily a movement disorder. Now we are into the mode of inheritance of the Huntington disease. There is a Huntington gene located on the short arm of chromosome number 4, which encodes a protein called Huntington. What actually occurs is trinucleotide repeat expansion of this trinucleotide called cage mutating the gene. This mutation leads to abnormal cleavage of the Huntington protein, interfering with nuclear mechanism and causing cell death. Thus, degeneration of the GABAergic neurons occurs, and at very last stages of the disease, the caudate nucleus is completely atrophied, and at this stage of the disease, the dementia is also manifested along with the abnormal movements and behavioral disturbances. So, when we deal with a genetic disorder, we say about some of the genetic disorders that this disease has a very high penetration. So what is meant by penetration of a genetic disease? What is meant by penetration of a genetic disease? Penetration means that if parents has a genetic disease, what is the risk so what is the risk that the offsprings will actually get the disease from the parents? What is the risk? So in case of Huntington disease, there is actually 50%. There is actually 50% chance, 50% chance of the disease to be transferred from parents to children. So we say that Huntington disease has a very high penetration because there is 50% chance that the disease will be transferred to the children from the parents. There is another concept regarding Huntington disease which is called anticipation. Anticipation means that the successive generations of the parents who suffered a genetic disease, specifically a genetic disease caused by trinucleotide repeat expansion, their successive generations tend to have the disease occurring at an earlier age. This is called anticipation. For example, one of the parents got a disease in their 50s, and one of the children of the same parents get the same disease in their 40s. This is called anticipation. This is actually due to further expansion of the trinucleotide repeats actually. So the successive generations, they tend to have the disease at an earlier age. So when you're dealing with a patient who you suspect for having Huntington disease or any other disease caused by trinucleotide repeat expansion, the family history become really important. You dig information from the family history regarding anticipation. So don't forget about the family history, especially about anticipation when you're dealing with a patient who you suspect for having Huntington disease or any genetic disease caused by trinucleotide repeat expansion. So moving on to the clinical presentation of Huntington disease. Huntington disease is primarily presented as chorea and personality changes or behavioral changes. Chorea, which is sudden, unintended, uncontrollable, jerky movements of the muscles of arms, legs, and even facial muscles. So it can manifest as uncontrolled grimacing with grunting movements of the facial muscles also. The personality changes include irritability, anger, paranoid type of changes, and there may be signs of depression even. So these behavioral changes accompany with chorea, which are abnormal movements of the muscles of the arms, legs, etc. So the chorea actually starts as fidgeting, which is actually a less severe form of chorea. There are movements but less pronounced movements. The gait actually becomes abnormal, poorly coordinated. So in early stage, there is actually no memory changes. The memory remains intact, but late in the course of the disease, the memory problems become pronounced. The dementia occurs actually, but and late in the course of the disease. This is really important. So from here we say that Huntington disease is primarily a movement disorder because the dementia is a feature of late disease only. So the diagnosis of Huntington disease is established by doing genetic testing for the presence of trinucleotide repeat expansion of this cage trinucleotide. So for establishing diagnosis, we do genetic testing, and as long as treatment is concerned, as you know, this is a genetic disease and we cannot do anything to change the course of the disease. We can only do symptomatic treatment to relieve the symptoms only. For the chorea, for the movement disorder, we give tetrabenazine. The mechanism of tetrabenazine is like it depletes the excitatory neurotransmitters like dopamine, serotonin in the brain, enhancing the inhibitory signals. So when you deplete the excitatory neurotransmitters in the brain, you actually decreases the excitatory signals in the brain and increases the inhibitory signals, which is the actual problem we face in the Huntington disease. And for the behavioral changes, we give haloperidol and clozapine, the antipsychotics, to ameliorate the behavioral symptoms. So here's the time for a fun question. Examiners sometimes ask that what is the role of counseling regarding consanguinity in cases of Huntington disease? Is there any role of counseling? The answer is simply no, because we all know that Huntington disease is an autosomal Huntington disease is inherited as autosomal dominant fashion, and I'm really sorry that I forget to tell you about this here in mode of inheritance. and that it is inherited as autosomal dominant fashion, but it's okay. I have written this here in role of counseling. And we know that on autosomal dominant fashion, we need only one defective copy of the mutated gene to be expressed as a disease. So there is no role of counseling regarding consanguinity in case of Huntington disease. So this was all about the Huntington disease. We tried our best to cover all of the aspects of Huntington disease in this video, and hopefully you got all the points which we mentioned here. And if you have any question, please comment down